everyone and welcome back to my channel. I want to start this video on a very good and positive note. First of all, I want to heartily congratulate all the students, all the candidates and all my lovely juniors who have successfully cleared this NEET UG 2023. I extend a warm welcome to all my juniors who are planning to get admitted in RG Medical College and Hospital, which is a very respectable government medical college in Kolkata. And yes, also there are many of you who have also planned by seeing their rank and the category ranks as well in state counselling as well as all India counselling, that they will get admission to RG Medical College. And many of you have DM'd me and they've asked me that you want to know a lot and like a brief information about the college and the hostels, the canteens, how the food of the mess is, about the like the ladies hostel, because as I belong to this ladies hostel. So yes, this video is going to be a brief introduction and a ride through our college, that is RG Medical College, and I have tried to make this video as informative as possible, and I'm going to give you a gist of all the subjects and the things that are happening in the college, including all the different buildings that are present over here. So without any further ado, let's get straight into the video. RG Medical College is one of the most renowned colleges, government medical colleges in West Bengal as well as Eastern India, and it is located in the heart of North Kolkata. Its location is great. It is situated in Sham Bazar. Its ranking is approximately 3rd or 4th among the government medical colleges of West Bengal after MCK, IPGMER or SSKM Hospital, and after that many people prefer NRS and RG like it's according to one's preferences. I'll be telling more about its location, facilities, pros and cons after a few points. So let me get started with the academics. Starting with the OPD facilities, the OPD building is huge with different departments allotted in different floors. So yes, the different departments are as follows. I'll be reading out from a text which I have in front of me. First we have the emergency building, which is a few steps away from the OPD floor, and so the different departments are divided accordingly in the OPD building and the emergency building. So the streams are, so there is antenatal clinic, there is asthma care center, there is radiothoracic surgery, there is chest department, dental department, dermatology, diabetes clinic, ENT, endocrinology, ophthalmology, gastroenterology, then gynecology and obstetrics, and then there is medicine, there is surgery, there is nephrology, there is neurological medicine, neurological surgery, then there is orthopedics, pediatrics, psychiatry, anesthesiology, and there is PMR, that is physical medicine and rehabilitation. After that we have physical medicine, we have plastic surgery department, we have radiotherapy, rheumatology and urology. So these are all the streams and the departments that we're having in our college. Also we have the Woodburn unit, and the gynae building is located separately in a different place, which is also very near to the OPD building. Now coming to the campus area, which doesn't matter that much, but I think it's a bit congested. Like the campus of RG Medical College is a bit congested because it's a very old college, and yes, at that time when it was first established, it was within the, it was a very small area, and after that it has definitely extended beyond its boundaries, and it has got a lot of new buildings, a lot of new departments, and there are new facilities that are being introduced into our college, like robotic surgery has also started recently. Many of you already know that because it was it came out in the newspapers as well. So yes, it's flourishing more and more. But yes, it's my personal opinion. It's that the campus area is a bit congested, and if there would have been more space and free area to roam about, or places where patients could sit, or the students could chill out and just relax, that would have been great. But yes, that's not a very bad thing. It's just a bit congested. So moving to my next point. Classes from second year, they take place in the academic building itself, but when we enter the medical college for the first time, the first year students get to do classes in the lecture theatres. There are 2 lecture theatres back to back, there is a common wall in between the 2 lecture theatres, and yes, they are huge. So this is our lecture theatre, and there is this gallery system which helps the invigilators or the teachers to see that whether people are doing stuffs at the back and sharing answers or discussing among themselves during the semester examinations, which used to be held in the first year of MBBS in the lecture theatres itself. So yes, it was a great experience. Like when we used to have our classes in lecture theatre, it was all a different experience altogether. But now we don't have our classes in the lecture theatre because they are only meant to conduct classes of the first year of MBBS students. And now we have our classes in the respective departments. Specifically, there is a common lecture theatre in all the floors in the academic building. For example, we have our pharmacology lecture theatre in second floor, then we have our physiology lecture theatre in the third floor, and community medicine, which is a subject of third year, that is third year part 1. These classes are conducted in the respective departments. Like we have to go to the classes which is located in that department. So yes, FMT also, this FMT, that is forensic medicine and toxicology, these classes are also held in the respective department. Now there are 3 main buildings for the students specifically. Number 1 is the academic building, which is the most important one. You will get to know it very well. When I was a first year student, I used to get confused a lot, like where is the physiology department, where is the pharmacology department, where is the biochemistry department. So because our practical classes used to get conducted in the respective departments, which are situated in different floors. So there is a lift, there are different lifts, like there are 2 lifts which are meant for students and 2 other lifts on the opposite side, which is meant for the staff, but student can use any one of them. But the patients or the patient party, the staffs are restricted to the opposite side lifts. When I was a first year student, when I used to take the lift and when I had to attend the practical classes in different departments, I initially used to get confused that, oh my god, biochemistry department, so I have to go to 4th floor. But sometimes I used to go to some other floor, like a floor beneath or a floor up. So yes, accordingly I went again. So academic building is the first building that I was talking about. The second building is the PJB building, that is Platinum Jubilee building, where the lecture theatres are situated and where the classes of first year MBBS are going to be conducted. Okay, I think the people who are going through their admission process right now, that is first round of state counselling, they will also experience that feeling of sitting in a gallery system, because the admission process are also held in the lecture theatres itself. So yes, it's in the PJB building, that's Platinum Jubilee building. And after that we have the third building, which is the anatomy dissection building. There are practical classes of anatomy are conducted, where we get to see the the dead bodies, the cadavers per se. And there we are taught what are the different anatomical positions, what are the different muscles, where is the origin, where is the insertion of different muscles, where is the where are the nerves passing, where are the blood vessels, which is the fascia, which is the superficial layer of muscles, which is the deep layer of muscles, which are the superficial compartments, the deep compartments, and the different organs, the different viscera, we got to see the bull's eyeball, then different organs of human body like kidney, heart, lungs. There are many things. So I am so excited that you people are coming and joining this medical fraternity, and you people are lucky enough to witness all the things that really happen in a human body. And you people are really blessed enough that you have got this opportunity. You are already admitted to a profession where you will get to relieve the sufferings of other people. So yes, it's a very noble profession, and I heartily welcome all of you, and do your best and come out as great doctors. Now coming to academics, in first year there are 3 subjects, which is number 1 is anatomy, number 2 is physiology, and number 3 is biochemistry. So in my personal opinion, my favorite subject was physiology, because it had a lot of concepts, and there were things that you need not memorize much, and there were also many things which you people will feel that you already know from classes 11 to 12. And after that, anatomy is also very interesting subject, but it has a lot to memorize, starting from the origin, insertion of different muscles, and all the things that I already specified when I talked about the things that take place in the anatomy dissection hall. So yes, it's very interesting, but it needs memorization. So yes, you have to work on anatomy, and after that comes biochemistry. Biochemistry is one subject that I used to hate in the initial days of my first year of MBBS, but after that, when I started giving it time, and when I really I felt that okay, now I have to read, and if I don't give my time to biochemistry, then I am not going to perform well in my exams, that is final prof exams. So that was the time when I realized that my god, biochemistry is a very interesting subject, and there will be different values given of different components which are present in the blood, which are present in the blood, which are present in the urine, what should be the normal bilirubin level, what should be the normal indirect bilirubin, what is the normal levels of direct bilirubin, what is the indication when one person's direct bilirubin gets like higher than normal, what can happen to a person, like what is the probable diagnosis when indirect bilirubin gets like increased above normal limits. It's hemolytic anemia. These things interested me a lot, and when I gave time, I finally found that biochemistry is one such subject which can be read in a very small amount of time, no matter how much faki you've given in the previous or the initial days of your college, because the initial days actually goes away having fun, and you need to know the other people, your friends around you, and that's a very crucial period because you are very new to a hostel, you are very new to a different environment, you are meeting people from different cultures and different socioeconomic status, and you get to know a lot of other people's opinions and how a different person looks at a thing, and yes, you get to know a lot of things, you explore a lot of new places, you learn new languages, like especially for the people who are coming from other states, like the AIQ students, they face a lot of difficulty in understanding Bengali because yes, you have to, the primary mode of communication, the primary language of communication here in Kolkata is Bengali, so you have to learn Bengali. Like it's not a problem because eventually after staying with the friends, after communicating with the teachers, because the teachers also they mainly like it's easier now, it's easier to communicate or explain something in Bengali because that's the mother tongue, right? The mother tongue here. So yes, the teachers, some of the teachers will also explain in Bengali, but definitely they will ask beforehand that whether all of you understand Bengali or not, and then only he or she will start explaining in Bengali. But yes, so Bengali, the IQ students specifically, they need to learn Bengali, and don't panic or don't feel that, oh my god, what is going to happen, I don't know Bengali, will I be separated out from the friend circle? That's not going to happen because other people are also coming who are like you, and everybody is very new to the environment, everybody will like find some difficulty in adjusting to the surroundings, in adjusting to the new curriculum, the new life that you people are going to enter into. So don't panic and just enjoy and have fun, and get to know other people around you, get to know your surroundings, get to know your college very well, because it's going to serve you later. Now, I just here want to give you a quick note that the three subjects of first year are situated in which floor of the academic building. So as I previously mentioned, that all the first year MBBS classes, that is lectures, theory classes, are going to be conducted in the lecture theatres, which is located in the PJB building, and the other practical classes which are going to be conducted, they generally happen in the academic building. For anatomy, it's a separate building which I already told, that is the anatomy dissection hall. There are two compartments, like there in this part there is going to be the histology lab, and there are a lot of microscopes, and you will get to know about the epithelium and the lining borders of all the viscera of your body, like starting from the esophagus, the hair follicles, the column epithelium, and there are many things. So yes, you will get to know about all the linings and the cut sections. Now for subjects, the other two subjects, that is physiology is department is in the third floor, and the biochemistry department is situated in the fourth floor of the academic building. Now coming to lab facilities, the lab facilities are also very extensive, and the various tests can be performed. The blood tests, different blood tests, starting from the bleeding time, the clotting time, the total RBC count, the total leukocyte count, that is TLC, the DLC, that is differential leukocyte count. These all are performed in the physiology laboratory, and in biochemistry lab we perform different blood tests and urine tests, urine examinations, specifically the finding out the specific gravity of urine, the presence of any kind of reducing sugar, protein, ketone body, or blood in the urine by different tests like Roth-Hera's test. Then we have the SBAC reagent test. Now there are a lot of instruments that are also shown in the respective departments by our teachers, which are very important, and you need to see the instrument, you need to identify the instrument, and in the examinations, practical examinations, you have to write the names of the instruments and then the functions. You have to ratify these very properly and you have to keep this in your mind, and yes, these are very frequently asked in practical exams, so you have to be thorough with all this. So these were all the academic aspects. Now coming to library. So library is one of the best places of RGCOR because it's a very spacious area, and there are 3 compartments respectively allotted for different state of students. Like there are 4 compartments. So there are different places for UG students, the first year and second year students. There is a specific place which is particularly allotted for the interns to read, and finally we have a specific area which is a closed area where there is no kind of disturbance. So that area is specifically allotted to the PGs or the house staffs, and there is another section where people go and they study. And there is also a fourth section which is ekdam opposite to the place where we go to borrow the books, and yes, there also you can sit and study, and there is a huge library where the books are arranged and you can borrow any book you want. So yes, the library facilities are also very good, but it has different specific timings. That is, you can't borrow a book after 4 p.m. And also there is facility that you can take a book, you can judge a book, that is, you can read a few pages and see whether it suits your language, or you can understand it properly or not, and then you can decide whether you want to buy that book or not. So yes, that facility is also provided, and it is fully air conditioned, and it's located on the 7th floor. That is, the topmost floor is the library. And yes, proper washrooms, like separate gents and separate ladies washrooms, are also there in that floor itself, that is 7th floor. So this was the part 1 of the college stories that I wanted to tell you. This was very informative, and in the next video, that is part 2 of the description of RG Medical College and Hospital, is going to come out within a very short period of time. And yes, there I will be talking about all the canteens and other different stuffs. So don't miss out on my next video as well, and hit the like button, share and subscribe to my channel, and make this video a great success. Bye.